Good morning, everyone. Your Excellency, Gary Quinlan, AO, the Australian Ambassador to Indonesia, Bapak George Iwan Marantika, IABC President, who will be our moderator today. Speakers, Dr. Andre Meliala, Mr. Peter Fanning, Dr. John Ackerman, IABC members and guests. Welcome to the first series of the IABC Roundtable on the subject COVID-19 Challenges and Opportunities. My name is Arfad Babarsha. I am the Executive Director of IABC. And before we commence the session, I'd like to inform you all will be muted during the session. We will have a Q&A session at the end. So if you have any questions, I would encourage you to communicate those questions to the host via the chat functions, or during the session, simply click the raise your hand icon and wait to be assisted. Thank you. And I will hand this to Pak George to commence the session. Over to you, Pak.
Joining you live from the Center of Public Health Policy and Management of the University of Gadjah Mada, in which this is one of Indonesia's leading think tank for public policy in health public policy. And I'm joining you because we will have a guest today, Dr. Andre Meliala, who will be sharing with you the Indonesian forecasts and policy in the future on facing COVID, and obviously the impact, the current impact and the challenges and the opportunities within. We have a distinguished panel consisting of, as I mentioned, Dr. Andre Meliala. We also have Peter Fanning, the IABC Deputy Secretary General, who is also a legal counsel at HHR law firm, but he is also the chairman of the International Business Council and also representing IABC on the board of the Australian ASEAN Chamber of Commerce. So he will give some insight also today on what the status of play, you might say, of COVID-19 and how business community, not only the impact it is facing, but how it can respond and react into the future. And we also have with us today Dr. John Ackerman, who is the director of PT Mitra Asia and the IABC treasurer, and he will synthesize the conversation that we have today regarding this topic, which relates to COVID-19, the opportunities and challenges that face us today as a business community. But before we begin, I would like to say first that we are very honored that this roundtable, this IABC roundtable, that is our inaugural roundtable, which eventually I'm in a four-square table, but not a round table, but it will do for a while until we all meet together. But I am honored, and IABC is honored that we have with us today the Australian Ambassador to Indonesia, His Excellency Gary Quinlan. I met Ambassador Quinlan when he was still the ambassador of Australia in Singapore, or the High Commissioner in Singapore, way back in 2004. And at that time, in 2004, he was already a distinguished diplomat in the diplomatic corps. And we are very honored to have him as the Australian ambassador to Indonesia, because he is a true friend of Indonesia. And through his term, or through his tenure, he has guided the implementation and the entry into force of the Indonesian-Australian Comprehensive Economic Partnership Agreement. So with this roundtable, this inaugural roundtable that IABC will be conducting, that is conducting today and in the future, specifically discussing current issues that relate to Indonesian and Australian businesses, this inaugural roundtable will be opened by His Excellency Gary Quinlan. And with that, again, it is an honor for IABC, it is an honor for me, and I think the distinguished audience that are here today for Ambassador to be able to open this inaugural roundtable. And with that, may I present the Zoom room floor to Ambassador Gary Quinlan to open this inaugural IABC roundtable. Ambassador, the Zoom room is yours.
Just try, there we are. Thank you, Pak George. Can you hear me? Just signal, because I was having trouble with the mute. Good. Look, selamat pagi. I think we're moving on a little bit through your day, but it's great to be involved like this. And I want to thank you and also congratulate Pak George, and the new board, newly appointed board of the IABC. You know, as everyone knows, the IABC itself has been around and influential, sometimes more than others, over the last 30 years. But in the last few years in particular, as we've developed the new economic partnership between Indonesia and Australia, the work of the IABC through what was called the Business Partnership Group in setting out what that document, what that agreement, that treaty should include, what are the priority areas, what are the kind of challenges we need to overcome, but then what are the prospective opportunities. All of that work has been sophisticated and influential. So it's important now that we get on with the implementation of CEPA, and more broadly, doing everything we can on the economic and trade side, but also on the investment side, which really is so much the key to how you integrate economies, as we know, in the future. I think it's a great initiative to begin this series, and you know, I'll try and participate for what it's worth in as many as I can, but the embassy will be following all of this very closely, and our Austrade team as well. There is a real premium on activism during this pandemic, and I think all of us in all our countries, business communities, all parts of the communities are discovering that that you can actually do a lot. It's not perfect, it's not organic, but you can do a lot. And more we're finding that people are stepping up to do so. Look, you don't really need me to say how disruptive the pandemic has been. It's been the most disruptive event globally, of course, for everyone, every society, every community, all our lives since World War II. And the implications are profound. I mean, you cannot overstate the implications for all our communities, all our societies, and our economies. I think Prime Minister Morrison gave a speech, I think it was about 6 weeks ago, where he had a sentence which I was particularly struck by, in saying that what we now face in the future as a result of the pandemic is a world which will be poorer, more dangerous, more disorderly. There's been a terrible lack of global leadership during this pandemic. The G20, which meets in November in a couple of weeks, really has been sort of missing in action, unlike during the global financial crisis when it actually came into being. The G7 economies, under US chairmanship, they haven't done very much. At the UN, the political arms of the UN, including the Security Council, people just haven't filled in this vacuum in leadership, and that has had one big effect, and that is it's made it so obvious to middle powers like Indonesia and Australia that we have to be more active, we have to step up, we have to do the mobilizing, particularly within our own regions, to get things happening and all the rest of it. So it really is a very big premium on middle power leadership, and Indonesia and Australia have been doing that. Our two leaders speak regularly during this period. Our Treasurer, Josh Frydenberg, Sri Mulyani, have very frequent conversations. Our defence ministers every few weeks, the heads of our respective security and defence agencies, our foreign ministers. In fact, the two foreign ministers had a conversation 3 hours ago for quite a while to go through current issues on our agenda, and other ministers as well in some of the functional areas between the two countries. I attended a ministerial council between the coordinating minister for security, Mahfud MD, and Peter Dutton on our side last week, involving the heads of all the relevant security and border agencies and so on. So we've both been putting a tremendous amount of effort in trying to keep the momentum going, so that we try and prevent, you know, the loss in so many of the areas where we've got cooperation. And it's not perfect, but I think we've done a pretty good job. Now, on the economic side, we know what we're facing. We've got the unique situation of both the economies of the developing world and the developed world for the first time ever since the Great Depression in the 1930s are in recession. The impact on global trade and global finance, everything has been really quite profound in some economies more than others, obviously. All of our economies are facing, at least initially, negative growth, and we're all struggling to try and get ourselves positioned through the fourth quarter into the beginning of next year to start rebuilding. We're all facing that kind of problem. We're all struggling with it, and all our economies are, are doing the same thing: interest rate cuts, liquidity injections, asset purchases by central banks, all of this to try and reposition, recalibrate our economies because it's unique. And it's very different from the global financial crisis. This pandemic, of course, has affected everything because it's gone directly to people's employment, everyone's jobs. Unlike the global financial crisis, which was bad, but it was much more specific in terms of how it affected our economies and was sort of easier to recover from, of course, and didn't affect our societies and communities in the same way. I mention that only because it underscores again the enormous kind of vista of problems that we're all going to be responding with. Look, in terms of where Australia's at just generally with Indonesia at the moment on assisting, we way back in April pivoted our development assistance program completely towards, or not completely, but almost completely towards helping in the COVID response, particularly in providing economic and technical advice on the economic side, what the implications were and what the menu of policy options were to respond to all of that. Health security, epidemiological advice, those kind of things, and excuse me, and particularly advice in areas like how we were all grappling with online learning for schools and kids, and also the social protection packages and how they could best operate and how you actually best targeted people across the society. We've got a long history of working with Indonesia in those areas. So that was one particularly large area. We've been talking, not announced in any way yet, about other kind of economic fiscal support. You can imagine what that might be. A lot of good constructive progress on all of that. And also a new area where we're particularly focusing, and the PM has spoken to the President about this, and there'll be further engagement over the next week or so, vaccines and what we can do to assist access to vaccines, and also, of course, ultimately production, distribution of vaccines, which is the key for everybody. In terms of IA-CEPA, I'd actually be interested to hear what other people have to say, certainly about the current situation in Indonesia on the health side and the economic side. So I won't give the normal speech that I give about what a groundbreaking, development it is and all the rest of it. We know that. And what we're trying to do and been trying to do over the last 6 months is rescue it, in a sense, from the inevitable downturn with the pandemic. And I just make a couple of comments about that. Number one, we here, and you know this because you've been doing the same thing yourself, IABC and the AIBC been doing it, but we've had an extremely active business promotion program. And the interesting thing is we've been getting tremendous response. I've done Zoom meetings with our Trade and Investment Minister and with others where we've had 1,200 people on one of them. Others have had, up of 500, 600, others 300, that kind of thing. Austrade have got a program called Business Connect, which has had something like 35, 40 different events promoting different aspects of the economic relationship and the new opportunity under IA-CEPA and other things associated with that as well over the last few months. And that's continuing over the next few months. We're establishing a new CEO roundtable of key people in each country to advise prime ministers and economic ministers on the new economic relationship we need in place. Our economic and trade ministers will be having a virtual ministerial forum fairly soon, once we can set it up. We've established, 2 months ago, I think, a new senior economic officials meeting, which is very practical. I participated in the first one. It's about aligning our global economic policy on, G20 agenda, WTO reform, that kind of thing, where Indonesia's, pretty strong in the same views both countries have on that. But more importantly, we spent a lot of time in that meeting, a few hours, going through very specifically some of the barriers that each of us already had started to identify in our economies to how successfully we're going to be able to implement IA-CEPA. And there's some work coming out of that, which is going to help both of us, because we're going to have to go through quite a long, sort of teething period till we get the benefits of it flowing in both directions. The closure of our own borders obviously has upset our ability to work on the skills package, which is so important to Indonesia in all of this. Our own Prime Minister and President Widodo have talked about this. So we're looking at ways, what can we do, but also how quickly can we get that student and skills exchange re-established? Of course, it's going to depend on Australian borders lifting, but it is a priority, and we're kind of serious about seeing what we can do on all of that. We're also working, and I'll conclude here, on what we here in Canberra are calling a blueprint for business on what are the best opportunities under IA-CEPA, and trying to create some pathways based on business advice on how companies can take advantage of that opportunity more quickly. So to try and give them a sort of step-through process, this is the opportunity, this is what you can do about it, these are other people you can potentially engage with in business and so on, to actually realise that benefit. So it's meant to be a very practical sort of pathway for people to help business, and it will become more and more sophisticated as more and more business, of course, opens up, and the pandemic, we get through the pandemic as well. But that'll be available hopefully by the end of the year, certainly by the very beginning of next year. Look, I think I've probably spoken a bit too long and covered just a couple of general things. But I'm very happy, when we get into the Q&A session to sort of talk further and answer any questions anybody has. But otherwise, let's get down to more serious business than me, I think. So, Pak George, over to you. Oops.
Thank you, Ambassador Quinlan. That was a very encouraging outlook, and we are very motivated by the many steps that the Australian government and the Indonesian government has basically prepared and executed in terms of not just, I was just reading the announcement of the consolidated effort to prepare for the vaccines. Yeah. And also the support of the Australian government in terms of that towards ASEAN. Also very encouraged by the initiatives that you have mentioned, including the blueprint. I think that blueprint would be very encouraging in terms of how Indonesian and Australian business community can take forward or move forward and take advantage of the IA-CEPA implementation, although we are in the middle of a COVID-19 pandemic. And so very encouraging words. And again, thank you, Ambassador Gary Quinlan. And we would definitely like to be able to have a conversation with you as we move forward on this panel. Now, I would like to give the Zoom room floor to Mr. Peter Fanning. He is an experienced legal counsel for Indonesia and Australian affairs, but also global affairs. And he also is the IABC Deputy Secretary General, but also the chairman of the International Business Council, which IABC is a member of in Indonesia, and also representing IABC, the director of the Australian ASEAN Chamber within the region. Now, one thing about Pak Peter, he is a true supporter of Indonesia. He's a believer in Indonesia, and we thank him for also the he's been presenting COVID-19 updates for the IABC member base on a weekly basis since March. And we really appreciate those updates because they have been very, very helpful to all of us who have been following what's going on with COVID-19. And so I want to give the floor to Peter Fanning to probably share his perspectives because he's been preparing those updates on a weekly basis and also from the outlook that he sees in terms of the business impact on businesses in Indonesia and within the region also. So Peter, the Zoom room floor is yours.
Thanks, George. I'm drawing on my view of the COVID situation from where I sit in central Jakarta. I present from the perspective of an Australian who lives as an ordinary resident as close as you can get to the centre of this large city. I update my written record daily, in fact, and have done so for the last 207 days and distribute it twice a week to Australian and other investors, except when my computer is down, as it has been for the last couple of days, but is back up again. My contribution is intended to be an informal resource covering recent developments, major milestones, basic current statistics, the legal framework nationally and for Jakarta, some relevant experiences, observations gleaned from international commentators. I've never intended to provide expert advice, simply to provide some practical information with a bit of local interest. People regularly ask me what is happening on the ground, and hence my answers. The statistics I report reflect the environment I primarily deal with, that is, Indonesia generally and Jakarta in particular. I don't try to venture beyond Greater Jakarta. The websites have useful graphs covering a range of statistical matters, but the simple listing of daily numbers which I provide I believe says it all. The pandemic is not going away as yet. I know I will not be able to feel reasonably safe until we have a combination of herd immunity and widespread use of vaccines. We know vaccines are a way off as yet, and in any case are not silver bullets. Above all, they are preventative measures, not cures. We do not know where we are with herd immunity because of low testing rates. We understand that herd immunity may set in when around 70% of the total population has been infected or has become more or less immune. The raw numbers reported reflect a steady incidence of death in Jakarta and not a particularly high rate, and also for Indonesia as a whole. However, while recently I noticed the press reported increasing death rates in some areas, this does not appear to be the general trend. Looking back, we are reminded that on 31 December last year, China advised the World Health Organization of a new strain of pneumonia, and this is of course not pneumonia, we know now. The new virus was announced on the 7th of January, and the first death was reported by China on the 11th of January. Indonesia began a partial closure of its borders on the 5th of February, and on 31 March imposed a full closure to those without pre-existing residency rights to take effect from the 2nd of April. At the same time, on the 31st of March, the President declared a public health emergency. Also on the same day, 31 March, the government issued Regulation 21, which introduced Indonesia's version of a lockdown called large-scale restrictions, or PSBB. It comes as a bit of a surprise looking back how relatively quickly action was in fact taken and how much was done in a short time. We also recall that some of us, or most of us, fondly hoped we would be through the worst of it in a month or so. It was always left to local authorities as to the measures they considered effective for their area. Indeed, PSBB could be applied only with approval from the Ministry of Health. From the start, the government has struggled to match the competing needs of public health and of the basic economic activity on which people depend. Only 30 districts and cities across Indonesia ever formally adopted full PSBB, and only 3 whole provinces ever did so, namely DKI Jakarta, West Java, and Gorontalo. Those of us watching ABC television watched on with some amazement as Australians fought each other in Australian supermarket aisles for toilet rolls. I, for one, have still never understood. I'm reminded of footage which a movie journalist friend of mine has of a visit to Nias by 2 Australian Navy helicopters in the aftermath of the 2004 earthquake and tsunami. One chopper was loaded with toilet paper, which was immediately distributed. After a short visit, the official party was making its way back to the choppers in Nias and found miles of toilet paper festooned among the trees. The people had no idea why they had been given all this paper. We have watched with bemusement while the debate has raged internationally about the use of masks. In the US, the use of masks, incredibly, became a political symbol. People in Asia, to their credit, have taken easily to the use of masks, much to the delight of those epidemiologists who regard universal use of even the simplest masks as almost as good as a lockdown. It appears not to dawn on many outside Asia that you are better protected if the next guy is wearing a mask and you wear a mask primarily to protect that next guy. Stories were appearing in the press about pending social unrest, but these did not take sufficient account of the fact that this pandemic is not the first disaster to hit the Indonesian people, nor will it be the last. In fact, from one point of view, Jakarta is a continuing disaster. So many seem not to understand about how ordinary Indonesians have always coped and will continue to cope. Indonesians who live in Jakarta, including and especially those living in the crowded kampongs, live in a city with only a partial and unreliable water reticulation system. The authorities claim 60% coverage, but that's doubtful. But even what is reticulated is not drinkable. Most everywhere have access to water bores, direct or shared, but north of Bundaran Hi, the groundwater is saline. People, especially in these saline areas, and especially where there is no reticulation, depend on deliveries commercially, sealed in sterile containers or hand-delivered by cart in open containers, depending on how much you can afford to pay. The household water bore is never very far from the household septic tank. There is no domestic sewage system at all. Rats are everywhere. By Western logic, everyone should have died a long time ago. But Jakartans have learned how to cope, and Jakarta is not a smart city, but the people are. The people have a right to feel let down, but they also know not to expect too much. On the 11th of April, the Jakarta government promised weekly deliveries of basic foodstuffs to needy households. In the 30 weeks since then, I have counted not 30, but 8 deliveries to the needy in the immediate vicinity of where I live. Some of these deliveries were quite small, The last delivery was on the 3rd of October, over a month ago now. There is plenty of evidence, of course, of people supporting each other and undertaking tiny enterprises to try to raise some money to survive. And investors out there are out there supporting those who work for them and their families where they can, even if they cannot keep them fully employed and paid. Australian investors in ASEAN have organised themselves to try to understand what is happening across ASEAN generally. Our organisation, AUSTRAM ASEAN, has run a couple of surveys this year and will continue this exercise in 2021 and beyond. Back in April, 48% of respondents anticipated a strongly negative impact on their business. By July, this number had dropped to 25%. The major challenge expected over the next 6 months from July, throughout ASEAN at 63% and similarly in Jakarta, is decreased demand for goods and services, perfectly logically. 71% of the respondents to our survey reported that the pandemic has provided opportunities, especially through virtual meetings and online tools. But a similar percentage, 70%, expect a decrease in revenue, apparently without that warranting a strongly negative response, as was expressed back in April. 27% linked the increase in opportunity just mentioned to greater staff productivity, while back in April, 59% of respondents had experienced reduced productivity from work at home. So people are indeed adapting. And I think adapting is the continuing story as we work with patients within the environment we have. Thank you, and back to you, George.
Thank you, Peter Fanning. A very comprehensive review. Thank you, Peter Fanning. A very comprehensive review on what you have been summarizing for us, especially in the IABC member community, on the updates on a weekly basis that you have kindly provided for us, and I think it was it's been very helpful for us. One aspect that you've mentioned, and I think you've observed very properly, is the resilience. There's a resilience in the community facing this COVID situation, and that is due to obviously our experiences in Indonesia in the past, and obviously in Jakarta where you're at, of many experiences, but resilience is there. And I think you have provided a very clear-cut outline of where the challenges are. And so thank you, Peter Fanning. We much appreciate your input. Now we're going to go to the next speaker, and before I introduce him, I would like to share with him the audience here today is obviously Ambassador Gary Quinlan has opened the panel today, or the roundtable today, but we have also audiences I've noticed from all over Indonesia and Australia here, from Perth, from even I noticed from Byron Bay, from obviously Melbourne, and also from all over Indonesia, also Jakarta. We are here in Yogyakarta, but I noticed some seniors here, IABC seniors, past presidents, Chris Solisto, our advisor emeritus, Bapak Muktarianto, and obviously many others are here. So Ibu Eli Hutabarat. So we have a wide range audience from Indonesia, Australia, pardon me? And also we have here some hospital directors, directors of hospitals Indonesia are here today in this distinguished audience. And I think your input during the question and answer will be very, very valuable. But now let me go to the speaker that we're going to have a conversation with. His name is Dr. Andreasta Meilala. Yeah. He is one of Indonesia's leading public health experts. He is an alumni of Leopold Franzen University in Vienna, Austria, and obviously alumni of University Gadjah Mada that we are sitting here today. Dr. Andreasta Meilala is the chairman of the Public Health Institute for Policy and Management in the School of Medicine at the University of Gadjah Mada. This is one of Indonesia's leading think tanks with over 100 researchers in public health that advises the Indonesian government, the Ministry of Health, the Minister of Health on public health matters and also related to the ecosystem that is related to public health. And obviously during COVID-19, this particular pandemic, he has been in high demand because of the issues that Ambassador Gary Quinlan and Peter Fanning has mentioned. We have him here today to sort of give us some insight, if possible, also some tips of what the formulation of policy in the Indonesian government looks like, or what it is and what it looks like and how it sees in the future, and how it impacts the business community of Indonesia and Australia. Yeah. And so with that, I will give the Zoom room to Dr. Andreasta Meilala. The floor is yours.
Thank you very much, Pak George, Your Excellency, and all the distinguished speakers. I'm Andre Meilala from Gadjah Mada, and please allow me to share my screen. Arfan, can you give me an access?
Yes, you have an access, Pak.
No, the other name, we have two names over here.
Hang on.
Yeah.
Yes, you have been made co-host.
So thank you very much from the side of the university, and I've been invited to this very important meeting. Thank you, Pak George, and also all the audience. We would like to share some information. I would like to share some information with regard to the COVID-19 preparation and also some policy that has been developed during these days. Yeah, so please allow me to share just a short presentation. Yeah, so before the pandemic, actually Indonesia has been involved in the international global health travels or tourism. So this is the expenditure that has been noted by the neighboring country, Thailand, Malaysia, and Singapore. And most of the patients actually coming from this country, from Indonesia. So we can see that before the pandemic, actually the citizens of Indonesia, they're experiencing good global services just around the world. This is only to name the countries in the Southeast Asia, but some of them are also going to Australia and also going to Europe or the US. And this is the scheme that we've been in the discussion very long before, that we have these 4 modes to transfer the health services in this country with another countries. So we can see here, the first is cross-border trade, that Australian doctors can make some kind of telediagnosis of an Indonesian patient. So one hospital in Australia, they can make some kind of partnership with the Indonesian hospital, and they can provide such kind of telediagnosis. And consumption abroad, this is very common, that Indonesian patient goes to Singapore or other countries for medical checkup or for certain treatment. And also in terms of commercial presence, we have a very relaxed policy here, because the foreign investment can be up to 67%. And this is, I think this is highest proportion among this country in the Southeast Asia. And also natural presence. This is also very important when the foreign doctors can perform medical practice in Indonesia. So actually, before the pandemic, this country has been involved in these global health services. And to look at the burden of disease, we can see in the website of International Health Metrics Evaluation in the Washington. They are in collaboration with us to develop such kind of dashboard. And this is the indicators that how well is Indonesia providing effective and essential health services. So you can see the figures here. It's not more than 50%. This is really in relation with what Peter has mentioned, that even in Jakarta, the essential services or public health is not really adequate. And then this is the word counts of the most deaths in Indonesia. We compare from 2009 up to 2019, that the lifestyle-related diseases are still in the first rank, but some infectious disease actually is going down and replaced by another lifestyle-related diseases, such kind of diabetes and also hypertensive heart disease. So we can see in this so we can see in these figures that strokes and then diabetes and also hypertensive heart disease is replacing the infectious disease. And what risk factors that drive the most death and disability, if it is combined, we can see here that malnutrition is really going down, and high blood pressure. This is also related to lifestyle and tobaccos, and this is diabetes, the plasma glucose, and high body mass index, and kidney dysfunction. Actually, these diseases are really related one to another. So these figures actually tells us that in Indonesia, actually lifestyle-related diseases is going up. And in terms of health expenditure, we can see here, maybe Pak George can translate this into Australian dollars. This is 414 trillion rupiah. Yeah. So we can see that the out-of-pocket money is still quite high. Even so, in 2014, we have been implementing the social insurance scheme, but then still 35% of the money coming from the pocket of the people. So it means that the insurance schemes that only covers 17% of the total health expenditure budget is not really replacing all those services that bought by the people directly without through the social insurance scheme. So the total number of health expenditure up to 2016 and the latest data is 2018. Actually, it's not really quite different. And this is also the same numbers. And I would like to go to the pandemic because this is the game changer. So we can see here by October 29th, then of course you can see these figures through the information that spread out by Peter. But then I would like to give some kind of description that if you look at Indonesia, we cannot look at Indonesia as a whole because we need to get into detail to certain or to the particular province that we would like to assess or we would like to know the conditions. Because as you can see here, we have a very different week of positivity rate per province, and we have a various number of tested cases, And we have also variation in the fiscal capacity, the healthcare capacity, the health system, and also even the policy. The policy in each provinces may be different in terms of how to get the case detection. So by these figures, we can see that the variation is really, we need to look at this into detail. So we cannot look at Indonesia as a whole, because the numbers among the provinces will be very, very different. And according to some discussions, we have 4 ways to test the resiliency of Indonesian health system. The first wave is the morbidity and mortality due to COVID-19. And the second wave would be the hospital financial crisis because of the surge capacity, and also the input that the additional inputs that should be funded by the hospitals. And then the third wave is health workforce stress and the infection rate, because as Peter mentioned, the social restriction is really swinging, and sometimes they opened and the people is going to the ground and milling around the city and the workplace, and they get some kind of infection and they will go to the hospital, and this is very dangerous for the health workforce. And the fourth wave actually is the morbidity and mortality due to chronic disease, as we have seen in the previous slides, that Indonesia actually experiencing this the chronic diseases. And during the COVID pandemic, some of them they don't want to go to the hospital even for a regular treatment. So this is some kind of situation that we are facing here, and this is also related to the business continuity of the hospital, because normally they have regular patients to do the hemodialysis or treatment for the stroke or the diabetes, but now some of the patients they don't want to go to the hospital, and telediagnosis actually is not really ready to support the patients from their own home. And this is the sectors that has been affected. And Indonesia, actually, in collaboration with McKinsey, we have such kind of scenario. We calculate everything, and we have the China simulation. We use the assumption from China and bring it to Indonesia, and we calculate. And we have also the Italian simulation and also US simulation. So from here, we can see that it depends on certain policy and also consistency to implement the policy to see the dynamic of these cases, whether it will be flat like in China, or it's going up and down like in Europe or in the US. It depends on certain factors that we would like to take a look later on. So what to do? So Indonesia actually, led by the state-owned enterprise, has developed up to 19 steps to tackle this issue. From the patient tracker dashboard, the first one over here, this is very basic. We should know who is the patient and where they're from. And then we do the COVID testing with the PCR, and we develop another equipment to support the testing. And we create the forecast. We develop the forecast with credible organization. And then we come into some micro issue, ventilators, isolation ward, ICU preparedness. And then we have also the dashboard to track the hospital ward and ICU conversion. This is to know the capacity of each hospital, and if the surge capacity happens, so we can see how well we will taking care of the patients. And also we have trainings program, and also the general preparedness. And the other steps, we also calculate the supply. We have the dashboard over here. And then we also check the capacity of the laboratories. Yeah, because from the study, we can see that if one district, they have a very low cases of COVID-19, it doesn't mean that they don't have these cases, yeah, because they don't do the test. So we urge them and support them with the capacity and also some facilities to do the test. And then the health expenditure for COVID-19. So we can see here, we have in rupiah, totally is 695 trillion rupiah. It is for the health sectors is 13%, and for social protection here, and even to give an incentive for small enterprise, to give incentive for all the industries, financial support for the corporations, and to support the local government. So it is all in the presidential regulation. So the money is secured already. And then in terms of social protection, this is out of this 619 trillion rupiah, because the government provide 200 more for social protection. And then the approach, as Peter mentioned, Indonesia is really is very careful to take an action, whether in the side of health or in the side of economic, because normally this is a trade-off. This is not. This can be a parallel action. And then in epidemiological approach, we have suggested the government to do this. This is very normal. But then in relation to the economic issue, I think we need to get some inputs from the international expert, because sometimes the policy of the local government, they say that we do the protocols, we should implement the very strict protocol, but due to economic interest, some of the protocols can be very loose. So in our observation, the swinging policy in Indonesia, we need to be very careful, because if they say that the PSBB or the restrictions is released, it doesn't mean that the protocol will be getting stronger. So they still implementing the same level of protocol, whether it is PSBB or out of PSBB. Now, so in conclusion, so there are three variables that we should look at: the money first, and the policy and strategy, and the executions. But now we can see that the money is there. The policy, we have seen that 19 steps of the government is really promising, but then the execution is something that we really need to look at. So if these three factors can be implemented consistently, so we go to the scenario of optimistic. While we are waiting for the vaccine by next year, and also the herd immunity, as Peter has mentioned before. And also we should look at this scenario over here, because we need to know where are we going, or where the Indonesian will be going, because it really depends on how we tackle the behavior of the people.
Ya tinggal aman sih, tinggal kita tentukan ruangan sudah fix, alat kan bisa pabon apa.
How strong we implement the protocol, the health protocol. So from this formula, according to our observation, we are going to this scenario. We'll be very optimistic because we have the money, we have the policy and strategy, and we are waiting for the firm executions. Thank you, Pak George.
Thank you, Dr. Andre, and we can have a conversation later on with Dr. Andre. This center is a very impactful center. It's the partner of, I believe, the CDC in the US, and also with Harvard, and also with Australia, with Melbourne Uni and Monash.
Yeah.
This center developed the issue of DB, dengue, with Monash. So this is a very interesting insight that you've provided, Andre, and two interesting aspects as an entrepreneur I would see here. Number one, at least from a government perspective, there is a leading PIC, you might say, and that is the state-owned enterprise. Yeah. So those 19 initiatives of COVID-19, which is an interesting number, 19 to 19, it shows that there is an execution game plan. Yeah. Now, one other aspect that you mentioned, very interesting. I'm a layman, entrepreneur layman. I'm looking at this COVID-19, and this is for our members also here, is vaccine and herd. Yeah. And I've heard the herd twice now. Yeah. So that's from Peter Fanning and from you. So this is interesting, vaccine and herd. So I think this is a conversation we'll have to discuss on the conversation. And now to synthesize the information that we received from Peter Fanning and from Dr. Andre Meilala, and also obviously the opening remarks that Ambassador Gary Quinlan has shared with us, I would like to allow Dr. John Ackerman, who is also the IABC treasurer, but also a true friend of Indonesia, has done business in Indonesia for over many, many years. He's the director of his company, PT Mitra Asia, and also very in tune with Indonesian affairs. And he's coming with us from Jakarta. And so with that, I will give the Zoom room to Dr. John Ackerman to synthesize and provide your input on these matters. Dr. John, the Zoom room floor is yours.
Thank you kindly, Pat George, and good afternoon, everyone. Before I start, can I just get a thumbs up that people can hear me?
Yeah.
All right. Thank you, Ambassador. I've been on way too many Zoom meetings where people keep screaming, "You're on mute, you're on mute." Actually, before I make a few comments, I just wanted to provide a couple of examples, both on the impacts we're seeing under COVID, the innovation that's being developed, particularly in the area of food. So I'm going to digress just a little bit, but George, but keeping in mind the issue of COVID and that food is health, and coming back to Dr. Andre's comments about malnutrition being down, but lifestyle and dietary diseases still going up. I see food as being a particularly important aspect during this period, but also into the future. So the first example I wanted to go through relates to some work we did with support of the Australian government and Indonesian industry, focused on understanding some of the priorities, the issues, trends in the agribusiness sector. And this was to try and better align research programs with industry while continuing to work with policymakers, producers, farmers, etc. Now, this work actually started before the pandemic, and under normal circumstances, the general focus of agribusiness was on developing effective transport and logistics mechanisms, reducing food loss, improving the quality of products, delivering effective mechanisms to ensure better food safety, improving linkages between farmers and their markets, retail or processing, and that actually included platforms, technology platforms, but also improving technology and access to technology with regards to better information to producers, developing and improving consumer trust and engagement, providing easier access and greater access to finance and capital, and of particular importance to the agriculture sector, keeping youth in the farming sector. Now, when we actually started to talk about some of the COVID issues that the agribusiness sector were facing, they included logistics and transportation issues, and particularly around storage and delivery facilities in the cold chain area. Obviously, some foods are perishable, and this causes problems if they're not moving. Commodity price fluctuations were a problem, including significant crashes for some. Corn in the eastern part of Indonesia was problematic. And this causes farmers great issues if you've been planning for a while and your crop is due to be harvested. Of course, that loss of the commodity price creates great issues. Also managing the demand to align with supply chain capacity. Now, this isn't just about reducing assortment of offerings, rethinking promotions, or introducing new products. It's actually aligning to things like Peter was talking about with how do you get toilet paper to consumers when the demand goes through the roof. Of course, safeguarding the health of employees and customers across a supply chain like this, particularly when you're talking about retail and food. Maintaining business continuity in this time period, and particularly that's an issue for all businesses. Improving online and digital networks and rushing to develop e-commerce platforms. That was particularly big for retail here, as it was, I'm sure, around the world. Postponing future development, and this relates more to building facilities or developing infrastructure at this time period. Improving the safety of payment systems. Now, this is particularly associated with the development of online shopping, bringing back consumer confidence following some of those changed consumer habits, particularly in the early stages of the COVID outbreak. And it certainly forced a lot of people to be innovative, and some in particular were chefs who obviously weren't getting the people coming through their restaurants. Revenue was obviously impacted, and so they had to look at ways in which they could still deliver a quality product to their customers at a time period when the economics was all changing. Now, so comparing some of those past issues prior to COVID with the current COVID-related issues, and what agribusiness is experiencing now is that many of the issues were already there. Now, this aligns particularly well with the Australian ADR Chamber survey, which outlined mid-year this year that some of the greatest challenges expected of business were going to be those things I just talked about: changing demands and consumer approaches, logistical challenges, and cash flow and access to finance. So the point I wanted to make about all of this is, whilst the COVID situation is here, it should remind us that some of the known and historical challenges became and still are critical shortfalls, not only during this highly disruptive event, but they were vulnerabilities in what we would have called a normal system. So I want to take you through a little bit of innovation, again, being supported by government, having industry involvement, but focused on research aspects. The Transport Network Strategic Investment Tool, or TRANSIT. Now, this is actually a tool that CSIRO developed in Australia for assessing Australia's infrastructure and logistic needs, particular to agriculture movement from paddock to plate. And through funding from the Australian government and working in partnership with the Indonesian government here, we're working on bringing this particular innovation into the Indonesian system. Now, the model itself is quite complex, and certainly there are people working on this far more smarter than I, but it's a series of mathematical models and layered information, including roads or maps of roads, port systems, shipping lanes, production areas, storage facilities, mills, processing facilities. It includes the demand that consumers are driving, and also the cost of moving aspects around. Now, it allows you to map product movement from paddock to plate, and it provides an estimation of real cost of moving a product from the production area through processing aspects to retail or wholesale. And probably of particular importance, it allows for simulations or scenarios to be run to examine infrastructure planning or infrastructure issues or even regulatory planning. But it allows for examination into disruptions. For instance, what we're seeing at the moment, the border closures, facility closures, demand change due to our current circumstances. Just to put up something or other so that people can understand exactly what I'm talking about. It's fairly intuitive in its mapping abilities. And for those that have listened to me speak on this particular program and project over the last couple of months, this is an update. We've been able to map all rice production and movement through Indonesia. Now, fairly intuitive, large production areas in the east of Java, large demand elsewhere. One thing I'd like to point out that you can't see particularly clearly within this particular slide is the model has actually mapped every single road segment through Indonesia, right down to Jalan Tikus. So you can drill down into specific regions or a distribution center or even a storage depot or a port to start working out some of the critical infrastructure issues or needs, including bottlenecks that can come up because of some of the disruptions we're facing at the moment. And importantly, and especially in the context of COVID, mapping this isn't the only use of the innovation, but again, the simulations can be run. So CFRO did this in Australia and identified some of the critical points along supply chains that would be in real need of attention, particularly for the Australian context with border closures and in many instances of temporary closures of facilities such as meat plants or other processing sectors. So in the Australian context, the meat industry was actually able to use this tool to understand the costs caused by a change because of border closures, plant closures, altered demand, etc. Now, there's a couple of reasons why I wanted to emphasise these two projects to everybody online today, and it relates to some of the aspects that the Ambassador, Peter Fanning, and Dr. Andreas has actually talked about. And that is, from the Ambassador's aspect, he's emphasised that there are significant communication processes happening between our high-level government officials. There's a lot of Australian development programs, particularly focused on health and vaccines, which of course I think we all applaud. There's the IA-CEPA and business promotion aspects, but also particular programs coming out of that, CEO roundtables, exchange programs, decision groups, all looking at our current circumstances, but also the future of where we're at, and including the blueprint for businesses. Peter Fanning outlined some of the aspects that he's been providing in terms of our summaries, talking about maybe Jakarta particularly being well connected as a smart city, but certainly that people are, and summarising updates on aspects that are ongoing at the moment, the issues that we're facing. And of course, Dr. Andreas talking about the health services, and again, particularly some of the issues that we're facing, not just now within this COVID period, but prior in terms of seeing malnutrition down, but lifestyle and dietary diseases going up, and having a real balance between health and economy, and the three aspects of that being money, policy, and execution. And it's in this that I really wanted to emphasise that there are in fact multiple programs, projects supported by government agencies looking to improve our working relationship, better assist industry for the betterment of everybody, for which many of us actually may be a little bit unaware, not just now within the COVID era and not just because of IA-CEPA programs, but this is where I would actually like to highlight, I suppose, where we would like to have a renewed focus. And whilst we are all facing challenges at the moment, be it personal, business, economic, health, there's a real need for effective and better communication in some of these aspects. Now, I've talked about two programs which some of you may be aware of, because you would have heard me before. Peter's been providing some very good communication processes. The Australian government keep going out to industry and to the Indonesian government to communicate aspects. And this is where I think we here in the IABC are hopeful we can actually go some way to provide a better communication process for you, for our members. A link between government and industry, a pathway to receive better information, but also to communicate your issues. And for that, I suppose I really would like to thank you, George, for your initiative for starting this as the first of the IABC roundtables under this aspect. And I would welcome everybody that's actually online to get in touch with the board, the advisors, our president, but also particularly the fact that we've now got a recently appointed executive director, due unfortunately to the very sad and early passing of Dick Halim. But we are in the process at the moment over the next weeks, months, and the next year of looking at ways in which we can provide a better communication channel on these issues, these programs, the aspects that the government are trying to bring forward. So please, I would request and urge everybody, if you have any particular aspects that you'd like to talk to the IABC about, please don't hesitate. And on that particular note, I'll hand back to you, George. Thank you very much.
For that, your remarks and synthesizing the information that we have received from His Excellency the Ambassador, Peter Fanning, and also from Dr. Andreas Mailala. Now, moving forward, we have a few questions in the chat group that I'd like to probably ask the panelists and ambassador here in regards to the questions presented here. Number one, it's from Chris Evans. Chris Evans is relating to JobKeeper scheme. JobKeeper scheme in Australia. Is there one here in Indonesia? What that appears to be, maybe Ambassador, you could share what JobKeepers is, because we have an Indonesian audience here. So again, I'd like to recognize the distinguished audience in this Zoom room, from academia to members of IABC, distinguished business persons from members of IABC, from government people here, and we have also hospital directors here on this chat group. So there is a topic regarding JobKeepers, and the question is from Chris Evans, can it be implemented also in Indonesia? That's the first one. And then from Ibu Selfie from Monash University. The question is, when will Indonesian students be able to go back to campus physically? That's from Ibu Selfie. And the third is from a distinguished auditor, a good friend of mine, Bambang Suwarso from KIB, a member of IABC, a very successful auditor, related to workforce. So with workforce today, we are now limited with our workforce, but we are still productive. That's what and more efficient. Actually, Bambang said we're more efficient. So how do we manage the workforce for the future? How do we manage the workforce for the future? And do they have to create their own jobs? Meaning, does our workforce then converse into entrepreneurs? And then from Ibu Dia, do we have any insights on what products need from Australia during the pandemic? Now, this is more of a business question, yeah. What products that can be captured? So there's 4 questions, and I think the first one is from Chris Evans. If maybe, Ambassador, you could share with us what JobKeepers is, and then relate that to the Indonesian government policy. And I'll ask Dr. Andre, can Indonesia implement something like that, what is being implemented in Australia? So Ambassador, again, thank you for still being on this Zoom room during your very busy schedule, but if you could share with us, because there's an Indonesian audience here, what, related to Chris Evans' question is, what is JobKeeper? What is JobKeeper that is being implemented in Australia? Please, Ambassador.
Okay, Pak George. Look, JobKeeper was a program which, oh, can you hear me?
Yes.
Yeah.
Yes.
JobKeeper was a program introduced very early on in immediate response by the government to the pandemic, because so quickly, when we had to go into lockdown, and we did that very early on with the pandemic, there was very obvious unemployment and the potential for greater unemployment, of course, over time. So there were 2 programs, and one was paying $1,500 a week to people to enable them to live, basically, because of the absence of employment. And there was another program, very similar, which provided money to companies to keep people employed, so that they maintain their jobs even when the job was not necessarily being done, but the government paid companies in order to maintain that level of employment, you know, and prevent even greater unemployment across the economy. Now, the programs, as we move through the pandemic and as economic recovery starts to happen in Australia, we had a negative growth the last quarter, but things are starting to improve and look a bit better. Then the amounts of money involved
We can hear you, no voice.
Can you hear me now? Yeah, I'm not sure where I cut out, actually. So JobKeeper and another program called Job Seeker, one was to pay employees who'd lost their jobs, $1,500 Australian per week to begin with. That's now being lowered a bit. And there was another Job Seeker to maintain money to companies to keep people employed, even when they weren't doing the normal jobs they would have been doing pre-COVID. So it was there were 2 programs designed to keep the level of economic activity, in the absence of economic activity, to keep people employed, basically, and getting money. Now, whether that can be applied in Indonesia, I'm not familiar enough with the detail of the social protection packages, I'm sorry. I do know they exist, of course. I'm familiar with the fiscal stimulus packages, but not so much on the social protection side, I'm sorry.
Thank you, Ambassador. So that's a great insight on JobKeeper and Job Seeker. And now to Dr. Andre, which is related to Chris Evans' question, is in Indonesia, we have, I think, subsidies, yeah, but yeah, subsidies. This is also support for corporates or small, medium enterprise. Yeah. Is there a policy or a plan to support small, medium enterprise in terms of, yeah, similar to a JobKeeper, yeah, but yeah, does the Indonesian government, in your assessment, have that in the cooking, you might say?
Yeah. So in terms of employment issue, actually, you can see from the tables that I presented, the government has provided a lot of money to not only for the people, but also to the company, even the small enterprise. And then their duty is just to run the company in a very basic operations, just to produce a minimum amount of production. And this is already justified to receive such kind of incentive. So in the tables, we can see that small enterprise, social protections, and then also financial support for the corporation, the big corporation, is already available or provided by the government. And also some tax relaxation already implemented. But then, is it already covering all the company all over Indonesia, or just some part of them? This is the question. But the intention of the government is already in the right direction to keep the income of the people, even in the very basic level. Thank you, Pak.
Thank you. So, Chris Evans, that is the answer from Dr. Andre. Now, I'd like to add that in terms of policy, there is policy, but it's really mostly for micro and very, very small business. And those are one-shot, two-shot subsidies. For corporate, we'll wait and see. Maybe through Dr. Andre and our collaboration with IABC in the future with this center, we can help formulate some ideas for corporate support. But currently, I think corporate support mostly just postponing, probably the banks are asking to be just postponing their credit installments on their client base. But that's from what I know. So that's related to corporate or small corporates or small businesses, yeah. Now, related to Ibu Selfie from Monash University. When are Indonesian students coming back physically to school? I am in a university right now here. One of Indonesia's Ivy League leading campuses, University of Gadjah Mada. Right now I'm here, physically here. We are physically here, but I don't see any students. So well, what do you think, Dr. Andre?
Yeah, thank you, Ibu, for the question. The university has opened the campus, but restricted only for those the last year students, just to finalize their assignments and thesis, and also the research in the lab, but in a very limited scale. The new students that enrolled this year, they are still studying from home, so they're not in the campus. But the repopulation scheme actually already on the plan, and maybe in the next semester, group by group, we will repopulate the campus with the students. So we will invite a certain level of students to come to the campus, particularly those who really need to practice the skills and also the laboratory works. But those early year students maybe still studying from home.
Yeah.
Thank you, buddy.
Thank you. So basically, Bu Selfie, it looks like we're going to be online for a while, yeah?
Yeah,
for a while, and maybe even till next semester.
Yeah.
I would say it would be difficult probably to go physical next semester.
Yeah.
Would you say that, Dr. Andre?
Yeah, but for certain students to finalize their thesis, their report, and also their laboratory skills, and also some residents in the hospital, they are already repopulated.
Yeah, so there are, but for certain students, they have to come to campus. Yeah. So that's for Ibu Selfie. Now, I have a question from Peter Fanning. Has Biden won yet? Well, we don't know. I think we're watching several screens at the same time. Now, another question from Muhammad Alfi. It's related to vaccine. Yeah. Is there a solution for vaccine? I mean, is it real? Is it, is it going to happen? What do you think, Dr. Andre?
Yeah, we can say that the pandemic is over if we have the vaccine or the herd immunity has already happened. But when we are talking about vaccine, all those factories or labs, they're not really up to the phase 3 testing. The most advanced, they said, is the Sinovac in China. But the report said that the Sputnik and also some European company also is approaching. But according to our government, they say that in the last period of 2020, we will have it. But according to our observations, it may not be in this last year or in December, but maybe in the mid-term of 2021. Yeah, because of course, the vaccine itself, when it is proven, then the production and distribution really takes time. And also the question is for who the vaccine should be injected for the first group. The government already mentioned that all those health workers should be the first group to receive the vaccine. So we have around 44 million health workers all over Indonesia. So maybe they are the first group to receive the vaccine. But the rest, 240 something million people, they have to wait. And this is the issue, Badr.
Okay, thank you. Now, I've been reminded by the host, the executive director, that we're coming into the 1.5 hour. So what we will do is we'll get these chat questions and comments, and if Dr. Andre or our colleagues on the panel would like to maybe add on to the chat, so we can, through the IABC Secretariat, we can answer these comments and questions via email to our colleagues here on this Zoom room. But I do want to respect your time. And again, I will begin to start to close this Zoom room roundtable chat with ending remarks. I will begin first with Dr. John Ackerman, Peter Fanning, and then at the very end, Ambassador Gary Quinlan, to then close this roundtable, this inaugural roundtable for this session. We will continue to have monthly roundtables discussing current issues. And for next month, we will probably be discussing the Omnibus Law, which probably in a while will be ratified, or I guess official, unless there are any objections that are quite significant in terms of the legal and political aspect of it. So with that, Dr. John Ackerman, I give you the floor to provide ending closing remarks, then Peter Fanning, and then at the very end, His Excellency Ambassador Gary Quinlan. Dr. John, please.
Thank you kindly, but George. Again, can people hear me?
Yes.
Okay, great. Thank you. Just very quickly from me, obviously, the health and economic aspects that we're all facing at the moment are challenging. I'll just emphasise again my comments from before that obviously good communication, consultation processes, information sharing are going to be key at this particular time period. And obviously not being face-to-face at the moment poses a couple of extra challenges, but I suppose from the IABC particularly, and I'm sure I speak for all of my board members and advisors, if you feel like getting on the phone to us, please don't ever hesitate. Thanks, Bud George.
Thank you, Dr. John. Peter Fanning?
Yeah, thanks, George. It appears to me, listening to John, that the transit may have some direct benefit in distributing the vaccines when they become available, because they need a secure cold chain to get not just to Bekasi, but to the further ends of Indonesia. So there seems to be a direct and immediate relevance there. But as John just said, communications are essential. This has been a great opportunity provided by George, and thank you, George, for your leadership in providing this opportunity, and for everything that's going to follow. So thank you. Thank you, George.
Thank you, Pak Peter. Thank you. Thank you, Pak Peter. And now in ending, His Excellency Ambassador Gary Quinlan, maybe if you could provide the closing remarks. Ambassador Gary?
Pak George, I guess people can hear me, so yep, okay. Look, just very briefly, thank you. Again, this is a great start to what you're planning as a series of engagements like this. And as I said, you know, we at the Embassy, all our components, the business, the trade, the economic policy, everything, will want to support you and continue to be involved where we can provide some useful input. Look, there was a question there from someone about, you know, what are the business opportunities during the pandemic? So I might send, over the next couple of days, might send you a piece of paper, which you might be able to distribute a little bit on where the trade flows are at the moment. It's been quite variegated, but the impact, despite the pandemic, on the amount of trade between the two countries, which is not big enough anyway, but the impact has not been as disruptive as we'd feared. And it's quite variegated in different areas. You know, live cattle is down 25% in terms of exports to Indonesia, but gold is up 276%, exact figure. And you've got increases in some of the cakes and biscuits and cereals kind of trade and so on. Tourism and education profoundly affected, but I'll send you a piece of paper on that. I would just sort of say that, look, one new area that we're all going to be focusing on, obviously, is healthcare, including telehealth, but healthcare generally, where there's preferential access under IA-CEPA, and food security, and the presentation that Dr. Ackerman John made was particularly interesting, emphasizing some of the more forensic thinking we can do in relation to food security needs in Indonesia, because we really can, if we see both economies as effectively over the longer term wanting to integrate more closely, then we can become a part of, Australia can, food security for Indonesia. And I think the pandemic has emphasized the way that kind of supply chain integration can become even stronger. And of course, we're all experiencing every day that the digital transition in our economies, which was already accelerating, is now going to definitely accelerate substantially because of the experience of the pandemic and how we've learned new innovative ways of doing business as a result. So thank you very much, and I look forward to staying in touch through this series.
Thank you, Ambassador Gary, and thank you for participating in opening this inaugural series, in which we will be continuing in the future. In ending, I want to thank again Dr. John Ackerman, Mr. Peter Fan, and also and Mr. Peter Fanning, and also the distinguished audiences that have been able to participate in this inaugural roundtable. Academics, businessmen, community leaders, hospital leaders. We are very honored to have you all in this Zoom room, in this Zoom chat room, and we thank you for participating from Canberra, from Perth, from Byron Bay, Melbourne, all the way to Jakarta, to this City of Education, Yogyakarta. Thank you all, and we appreciate your participation, and we'll see you in the next series of the IABC Roundtable. Yeah. Have a good day.
And we will have a